Hi, this is my short video, introduction video for my professor and my classmates. Hi, my name is Rachel Nakazi. I'm a nurse. A registered nurse. I started out as an LPN over 15 years ago. I advanced. I got my associate license in nursing, and then I ended up doing the bridge at the Regis College of Nursing, from associate to BSN, and now to into my psych nurse practitioner. I work as a nurse case manager at one of the local partners hospitals here in Worth, in Newton. Most of my experience in my career is mainly geriatrics. I have done geriatric case management. I've done hospice. I have been a supervisor in a long-term care facility, in a subacute, and I worked on the dementia unit. That was quite a challenge. That's when I started getting interested in mental health. I've done group home hospice, which too was a challenge, but loved it and liked the way they were well taken care of, and how strict that the Department of Mental Health is when it comes to these mentally challenged patients in the group homes. Originally, I'm from Uganda, but I've been living in the United States for over 20 years, and I received my education for the most part here in the United States. Some of my hobbies: I like window shopping. When I don't have money, I love shopping, going to the mall, taking my children. I love vacationing. I love Florida. I love Mexico. I've been doing a lot of online shopping because I don't have time to go to the malls anymore, unfortunately. Something unique about myself is that I'm very easygoing. I may not look like it, but I'm pretty easygoing. However, when it comes to the safety of my patients, I do not take it lightly. I take it very seriously. I do not compromise safety in an inpatient or outpatient setting. I do believe that that is one of the most important things, and I find it as a basic need for every patient. Um, Something where I would like to practice after I pass my boards, my psych nurse practitioner boards, is that I would like to go into a psychiatric hospital like McLean Hospital here in the Boston area. It's quite famous, and I like to probably like eventually go into individual practice and consult. I do like Jerry Psych quite a lot, so I think I may focus on Jerry Psych. Um, Something about my family: I'm married. I have 3 children. I have 2 teenage girls, 15, 13, and a 9-year-old son. The teenagers are quite a challenge. I'm still learning how to take care of a teenage girl, and yeah, I'm getting the shock of my life and surprises at the same time. How my beliefs have evolved over time regarding mental health is that it's actually a disease, and these people are suffering. I didn't know how extensive it was, especially in the United States and after status post-COVID, but now I realize how serious this is. In my country, when I was growing up, I didn't know, what it meant for somebody to have a mental health challenge. And actually, it's after I came to the United States many years later, 20 some years later, that I realized, and I'd be like, oh, so and so actually had a mental health illness. When I studied the symptoms of schizophrenia, Alzheimer's disease, I remember, my folks in the village, that, oh my God, this was mental health that had gone untreated, and many times they die because of alcoholism and lack of rehabilitation after drug use, and we just didn't know at that time that they were suffering, that it was actually mental health illness that is untreated. So my beliefs about mental health have actually evolved over time. In my country, people don't believe in depression, don't believe in much of mental health. They don't believe in counseling. They think that is a Western culture, and they believe that community is all you need to be strong, and that women should be strong and just suck it up. It has really evolved over time. I do now believe in counseling. I believe in psychotherapy, in addition to medication management of several psych illnesses. So I do believe that I have evolved over time, and I'm actually proud of myself where I'm at right now. And I know I'm going to learn a lot more in this class. I look forward to working together with the professor and my classmates about this, and I'm excited. Thank you, and have a nice day.